the question then that we need to address, and certainly a country like India needs to address, with vast deficits still in this area to be covered, what explains this early success and then this lackluster performance? And here I want to fall back on the analytical framework of what I mentioned at the beginning, the World Development Report 2004, and why it suggests that it's easy to deal with these first-generation reforms, but not so easy to deal with these second-generation reforms. And a crucial point there is that for these very specific kinds of outcomes, such as learning, such as the quality of education, skill formation, dealing with non-communicable diseases, you have to have much stronger ability to monitor outputs, to monitor outcomes. You have to provide incentives to providers so that they are able to perform the services in the way in which they must be performed, and politics becomes much more important. So very quickly, this framework is a very simple one. Many of you may have already seen this, but if you think about the provision of any particular service, say buying a kilo of rice or buying a meter of cloth, there is a relationship where you go buy something. If you find that it is the appropriate quality, it meets your expectations, you then go back and perhaps buy from that same provider. But if you don't find that, you move on to somebody else. Competition, in some sense, for the private provision of a good or a service takes care of this. But when you move to service delivery in these areas of education and health in particular, then the state comes into play. And by policymaker, I mean the state. And now the relationships that we saw in the first case become much more complex. There are now relationships of the kind of client power that I mentioned earlier, that competition gives you. But there's also a relationship between the state and the provider. I'm calling it a compact here, but it could be a contractual relationship, a permanent employment relationship, or it could be something else. And there's a relationship of politics, that is, citizens elect their policymakers, at least in democracies that we have in this part of the world. And I call it voice, but it could certainly be called politics as well. And there is now a much longer route of accountability because it involves politics first, and then it involves how policymakers and politicians deal with actual providers. And it is a much more complicated route than the short route of accountability that links the recipient of a service directly to the provider. When you think about accountability, there are at least 5 components that are worth thinking about. One is the delegation, that is, you're asking for something to be given to you or sold to you. You're financing it through the price that has to be paid. The service is performed. It gives you certain information. And most importantly, you have or do not have the ability to enforce some kind of accountability on the provider. So, for example, information campaigns allow you to enhance the information that you can get, to compare the service that you're getting with other benchmarks. Collective action allows you to do something when you delegate or when you finance a particular service. And sanctions and redress, of course, allow you to enforce accountability. But these are all complex things that, in the case of first-generation reforms, were easier to do because of the ease of monitoring some of the outcomes, the ease of writing contracts or creating the conditions under which states could provide. What I want to focus on as I conclude is the role of politics in service delivery and why that has to remain or is a very large part of the unfinished agenda that I think countries in this region will have to deal with. Even more than we emphasized when we wrote the World Development Report for 2004, I think we now recognize that politics is actually key to the entire service delivery chain. Even if you have strong ability of the state to monitor and supervise providers, if the politics is wrong, that strong ability will not yield results. For example, very few parents would want absent teachers, but nonetheless, and these are the parents who actually elect the politicians, but nonetheless, the politics makes employment norms and contracts possible that actually permit and sometimes even encourage the kind of absenteeism that is endemic in this part of the world, with absence rates of anywhere from 25 to 60 or 70%. based on very carefully done surveys of absenteeism amongst teachers. And politics, therefore, in a sense, dulls the advantage that information campaigns or collective action can provide to clients of services to be able to enforce the kind of service delivery that is necessary to get the kinds of second-generation outcomes that are important. In this situation, I think we have, in this part of the world, have had to balance market failures and government failures, because political failures or political market failures really are a class of government failures that we need to be thinking about. And in South Asia, and this is part of the unfinished agenda, I think, for us, we have perhaps more often than not underestimated the scope, the depth, the breadth of government failures, and in some ways have gone blindly into thinking that in trying to correct market failures, governments always will do right. And that has not been the case in many instances where we've seen major expansion of enrollment, but without the ability to actually show and demonstrate the learning outcomes that should have gone with that kind of with that kind of expansion of enrollment. So I want to end with one last point, which is we've talked about market failures, we've talked about government failures. In our part of the world, we've increasingly, and actually in other parts of the world, we've increasingly turned to participation as the magic solution. But I think we need to be very conscious that there are also civil society failures. We've assumed that school councils, urban resident associations, all work for the public good, but that may not be the case. The same sorts of problems that beguile government failure, asymmetric information, inequality, coordination, can also be very important in the case of collective action. Research that the World Bank is doing and is yet to be published suggests that, and this is a survey of about 500 rigorous studies of collective action and participation, suggests that in effect collective action works when there are effective state institutions. An example of this, when you have strong institutions at the center or at the federal level who are able to impose standards, who are able to monitor and evaluate, then one finds that decentralization works better. And it's ironical that in some sense one is trying to address governance failure or government failure, but that becomes harder to do in situations where the institutions of the state themselves are weak. Evidence also suggests that the poor often benefit less from participation as opposed to other segments of society. So civil society failure is also something we need to be thinking about. So I want to end here by saying that there are a range of issues that we need to be addressing. I'm going to skip over these cartoons and come back to them later on, but I want to make the last point that one size will not fit all, but there is a great deal of room for learning and piloting, as we've seen from the Sri Lankan case, from the Mauritius case. There is ample evidence available, and there are ample resources and ample opportunities for us to be thinking about what works where, why, and how, and then to be able to scale up. And I think that is the core of the unfinished agenda that we need to address in South Asia on service delivery. Thank you very much.